Yeah, no problem. Thanks, Emma. Good afternoon, everybody. My name's Paul Miller, and I'm the head of IT at the ICB. I've just got some updates for you today. I'm just going to share my screen with you. I will say that the update I'm going to give, I've presented quite a bit of this in the last primary care digital steering group and the primary care strategy delivery group. So if you're an attendee at either or both of those meetings, then you will have seen this this information before. So I'm going to talk to you about today is just three areas really. So I'm going to give you an update on the primary care access recovery plan from a digital perspective. Talk to you about some key focus areas that we've got in 24-25 around digital strategy, decision support and digital comms. And then I'm going to talk very briefly about the digital maturity assessment, or the DMA, that we've been asked to do this year. And then if we've got any time at the end for questions or feedback, I'd be happy to take questions at the end. So onto the PCARP update then. So I'll start off with the PCARP funding. You may be hopefully aware that NHS England made available some funding for 2 years non-recurrently in 23-24 and 24-25. 23-24, that was 93p per patient. 24-25, they've made available £48 million across the system, which equates to 76 pence per patient, but they've said that we can go up to 93p per patient if we need to. It can only be used, this funding can only be used to purchase products on the Digital Pathways Framework. The slight challenge with that is that Digital Pathways Framework isn't yet live due to a legal challenge on it. So we've had to put some interim procurements in place that allows us to ensure that there's continuity of digital provision across colleagues in primary care in the ICB. The ICB hold these contracts, and there's a continuation of coverage until the Digital Pathways Framework is launched. When the framework's launched, the funding is accessed in the same way as the GP Foundation systems is, so effectively transacted directly between NHS England and suppliers. So it doesn't fall into local ledgers. So we don't see any of that money fall into our ledgers. It's transacted directly through NHS England and the suppliers, and we just act as a call off agent to that. One of the things that we're talking about with the PCARP funding is we're not clear yet, or we don't know yet what products and services are going to be on the framework. But one thing that we'll stick to or would like to continue with locally is ensuring that we're following the national and ICS strategies around using the NHS app as the front door. So anything that we look to procure, we would look to ensure that it interfaces and is integrated with the NHS app, so you can use that as the front door. And just to give you a little flavour what sort of stuff you can use the PCARP funding for, I don't intend to go through this in any detail because I'll share the slides at the end, and there's quite a lot on here. But just very briefly, these are the kind of things that we can use the PCARP funding for. So it's all around online consultations, online patient service, user requests, communication management, cross-organisation appointment bookings, video consultation, etc. So a lot of the stuff that should be familiar to you if you use the things like Accurex or Engage eConsult. They've also added for 24-25 demanding capacity planning tools that we can draw some money off. So if there's anything on here where practices or primary care colleagues would see a need and would like to use the funding for, then we can do stuff around access of pre-configured dashboards, custom dashboards and data management. On first pass, I'd say a lot of what you can see here, you can probably get through eHealth Scope and sort of the Power BI stuff that the SAIU produce as well. However, if there is anything on there that comes out that you think would be useful and you wanted to talk to us about it, then that's absolutely fine, and we can talk through that with you. So that's the PCARP funding. In terms of just some, I guess, just some progress stats, some metrics around what it looks like currently in Nottingham and Nottinghamshire. So this data is from February. That's the latest data I've been able to get hold of, and we've seen over July 23 to February 24, we saw a 47% increase in the amount of online consultations that were going through the system. Around about 12% of those are via the NHS app. The rest will be via local practice websites or through System Online, etc. From an NHS app perspective, so 54% of, that should say, the Notts population, Nottingham and Nottinghamshire citizens have it. That's 593,000 people. We're seeing a 6% increase over the year, so 4,500 new registrations each month. And we're seeing 80,000 repeat prescriptions go through the NHS app each month as well, which is an estimated 30 seconds per repeat prescription saved through using the NHS app. Just an interesting stat there, and I don't know how they've worked this out, but I pinched it off another PowerPoint, so it was quite an interesting stat. It's from Shearers Forest Hospitals Trust. They did a study to say that around about 20% of their outpatient letters are now digital. So that's 10,000 letters. There's been a reduction in cost, and also in sort of the net zero, the green NHS agenda. There's been a 4 metric tons carbon saving as well, doing everything digitally over paper. So that's where we're at in terms of progress with the online consultations NHS app. Cloud-based telephony. So we're currently working with 85 practices in Nottingham and Nottinghamshire to implement advanced cloud-based telephony solutions. That's off the central procurement framework. All of those 85 practices have contracts signed, and there's lots of activity going on at the moment in terms of getting those systems in. And I'm sure a lot of you on this call are heavily engaged in that work at the moment as well. So thank you very much. I know it's been a real challenging one, and some really challenging timelines that we've had to work to, set to us by NHS England. This area, as I'm sure you know, has got a significant ministerial political focus on it as well. So this is a key area that we're getting lots of support and requests for information on in terms of that system approach. So yeah, so really good progress there. So thank you all to everybody involved in that. As I say, I know it's been a real challenge to adhere to some of these timelines and get things going. On to key focus areas for this coming financial year for in the digital space. So just listed a few there. So the first one I wanted to talk about was the primary care digital strategy. So Dr. Vinay Shankar and I are in the process of reviewing and refreshing the digital strategy for Nottingham and Nottinghamshire. We're working to refresh what was done in the strategy 21 to 26, also looking to make sure that we're linking into all of the other strategies that we've got knocking about at the moment. So there's the digital Notts ICS strategy, which if you haven't seen, I can share with you as part of my slide deck. Obviously the ICS strategy and the ICB strategies as well. From a digital perspective, what Vinny and I have been looking at is I guess three strands really. Is around getting the basics right, optimizing what we've got, and innovations and innovate as well. So getting the basics right really is just around obviously making sure that you've got the right tools and the right technology, the right infrastructure, the right training to be able to engage and deliver some of the stuff that you need to deliver digitally, enable you digitally to implement the modern GP access model and all that process around there. Optimizing would be workforce development, making sure that we're getting the best out of what we've got. So things around sort of optimizing the cloud-based telephony side of things, online consultations, and making sure that we can get the most out of our investment, both in terms of finance, but also in terms of the amount of time that we've invested collectively in this to get things moving. And finally, innovate. Some of the stuff that we're looking in the innovate space is around AI, robotic process automation, looking at long-term conditions management. So being able to manage patients, to be able to manage their long-term conditions remotely. And also looking at stuff around digital translation as well. If there's any digital translation services we can look at as well in that innovation space. The next step that we're looking at on our digital strategy journey is to start to socialise the strategy and get engagement and feedback and ideas from colleagues out in Nottingham and Nottinghamshire primary care. We need to make sure that you're involved in this and you've had input in this as well, and your requirements and needs are built into the strategy too. So we're going to be putting together a bit of a comms and engagement piece to get you all involved. But I wanted to use this LMC meeting as an opportunity to just present this to you now at this high level and really ask you to start thinking about what would you like to see in a digital strategy on those three taglines of getting the basics right, optimizing and innovating as well. If you've got any initial thoughts or ideas, please do email myself or Vinay directly with those, and we can pick up conversations with you in that space. But we're really keen to get you involved in this and get your ideas in terms of what you would like to see. Greg, you've got your hand up. I'll happy to take a question.
Yeah, sorry. In terms of what would we like to see, we'd like to see our notes digitized. I mean, that's been spoken about for ages. It was meant to happen, then it got paused, then COVID came. I have heard nothing about that for ages. So I don't know. I mean, it's a huge job, it's a big task, but I don't know when you think that might happen.
Okay, so we got some funding a while ago to do some of this work. It was quite limited funding in terms of splitting it across primary care. So I think the program started, it was just before, well, it was the year before I started, so 2021, 2022, and it was looked at, and the project was raised to digitise the medical records of the EMIS practices in the Nottingham and Nottinghamshire region. For System 1 practices, we're in a bit of a catch-22 situation, to be honest with you, between TPP and NHS England. We've been told that we are waiting for the development and implementation of a central repository that TPP practices can use, but there isn't a mechanism at the moment to be able to do that. We're also not clear on funding at the moment either. We did have a planning meeting, a local planning meeting this morning, Greg, with primary care IT colleagues, and digitisation of Lloyd George medical records was on there as a placeholder. But we're in a position at the minute where we're waiting to hear nationally what the view is. So it's definitely there on the list of things to do. So it's not been forgotten about.
Thank you.
Okay, thanks for the question, Greg. So that's around the strategy. What we're looking at as well is decision support and F12. So what to do in that space. So from an F12 perspective, as you know, it's a locally developed, locally hosted application platform that's developed in the ICB. We've put an options paper together and put that forward to the medical director, so the medical director and the deputy medical directors, in terms of what we think we need to be doing with F12 in the future. The paper acknowledges that the F12 is a foundation stone of general practice of primary care within Nottingham and Nottinghamshire. So there isn't an option of just not of stop doing it, of not to do it. What has been recognised though is that the ICB isn't the right place to be delivering the F12 service from. So we're looking now to understand how that might look if F12 needs to continue, where would be the best place to deliver that from, and how would the funding model look? How would that happen? So the options paper that we did, I put out to consultation and review to the primary care digital steering group, and I've asked for feedback on it by the end of this week, and then we can share that wider once I've got that feedback back. But I think the message really is that we're, you know, F12 in its current guise, in its current delivery model can't continue, but we also know that we can't just stop doing it. So we've put a recommendation forward in terms of how we think that can continue, and that's through either it being hosted by another organisation within the NHS, or looking at a third-party commercial organisation taking it over and then providing it in a commercial arrangement. The next bit I wanted to talk about was just digital comms. So within Digital Notch, which is the integrated care system group, the digital group, we've been talking quite a lot around digital comms, and particularly around sort of the SMS messaging side of things, which has grown exponentially over the last 12 to 24 months. We spend a significant amount of money on SMS texting. We've also got a number of different methods of texting as well. So we've got MJOG, Accurex, we can use the NHS app, you can use the System One Annex and so on. So there's quite a big area and quite a big opportunity for us to look at some making things easier and looking at some savings as well that we can then reinvest into digital. That's just in primary care. When you times that out across, you know, all of the ICS partners, then, you know, the amount of money that must get spent in the acutes on texting, for example, must be equivalent. So I think there's an opportunity here to be doing something systemic across the board, and again with the patient in mind, making it as easy as possible for the patient to be communicated with and receive communications. Because, you know, if you're a patient under the care of a number of different NHS providers, then, you know, there's a good chance that you're getting text messages left, right, and centre. So making it as easy as possible for patients to engage with the NHS as well. Greg,
what's the cost of an SMS message?
So currently it is 2.4 pence. Okay. And in total last year, just on text messages alone, we spent around about £500,000. So we send, I think there's around about 2 million texts a month we send locally.
Yeah,
so it's significant.
Yeah, it is significant, but compared with the cost of a missed appointment, either in primary or secondary care, you know, we get pushed not to do this, but actually we need to talk to patients. We need to send messages. The cost of a second class stamp is prohibitive. The text message is by far and away the quickest and easiest way to do it. And I hear from colleagues around the country that they're being constrained by their ICB, and then with potential charges being sent back to practices. So I hope it's not something that's going to happen locally.
Yeah, so it's just to give you the assurance, Greg, it's not something that I'm proposing that we stop and we take away. What we need to look at is smarter use of the stuff that we've got. So, you know, for example, when you send a text message out, do you need to put the full practice address in the text message? Because if you do, then obviously that increases the cost, and it goes across the fragment. So it's not, I should say, it's not 2.4p per text message, it's 2.4p per fragment. So if you send out a long text message that's 5 fragments long, and you send that out to a 10,000 patient list, then that's a significant amount of money that's been spent that could be better spent if you reduce that text message size down to 1 fragment, or use smart messaging, for example. So it's smarter use of rather than stopping use of, if that makes sense. Because I agree, you know, that there's benefit and disbenefit to using SMS texting. So that's where we're at with that. Yeah, PCARP and digital pathways framework. I've spoken about that.
Sorry, can I just go back to text messaging? I just put my hand up. Yeah. It's one of my bugbears, because I think the text messages that we are able to use are really unfriendly with patients. So if you want to send, you know, quite a detailed text, it starts with the third message first and then second first. And you've got kind of like, it doesn't say Lombard Medical Centre, it kind of says NHS no reply or something on it. So it don't identify us. I mean, we're one of the biggest organisations, the NHS, and yet it just seems really scrappy compared to, say, John Lewis or anywhere else. And I think it's really confusing when we're trying to get so much messaging now out to patients, and it is our only way at the moment for it to be, you know, just it's just not very good. It's not, the quality's not there. And I know what you're saying, get it down to bytes, but sometimes you can't when you're really trying to inform your patients of how to order a prescription, for example, or how to book an appointment, and you want to get these messages across. They don't always like clicking on links to letters. So it just needs tidying up. It's really, it's not user friendly at all, and it looks unprofessional.
Yeah, I agree, Debbie, and that all comes as part of the, I guess, the digital comms strategy and how we can best use the tools that we've got to be able to most effectively communicate with patients. So, you know, is there stuff that could be sent via email, for example, or is there stuff that could be sent via the NHS app? I think it all needs to be considered in the round, because there's significant digital exclusion, digital inclusion stuff that we'd need to consider as well.
I mean, Paul, I got
that.
a message from Monique about this email thing, and again, it drove me nuts. I mean, it took us years to collect telephone numbers. Could you imagine how many years it takes for us to collect email addresses on 21,500 patients, and all the restrictions around that? And it's
Yeah.
not instant. If somebody sends me an email on my Hotmail, I probably look at it every 6 months. I don't look at my emails at all, my private ones. But an instant message is there. It's impactful. It'll say, you know, we're really struggling today. Please only call us if it's, you know, urgent. We need those kind of things. So I've had this email from Monique saying, you know, you did some survey and patients like emails or whatever, but it's really not practicable at all.
Yeah, sure.
So
Sure.
yeah.
And as I say, it needs to be covered as part of that digital comm strategy, really, to make sure that we're as I say, that we're making the best use. We spent, as I say, around about £500,000, between £500,000 and 600,000 on paying for text messages alone. But then we also spent around about 400,000 on text messaging platforms. So £1 million on a texting service is a significant chunk of the primary care GPIT budget that we've got, that we could potentially invest in more in other innovative solutions and other innovative services that may be able to help as well. So again, it's around that strategic approach to make sure that
Yeah,
we're making the best use of our
we've got to be
resources.
really in line with this. So from our strategy and yours, because we've just switched on to doing our med reviews all by questionnaires, and it's a game changer for us. We've got a locum in at the moment. He did 58 in one day med reviews, and they're all quite, you know, quality. We've had Matt Doy write as a system and everything, and that is all on text message. The patients, and being able to respond back to that. So I mean, that's a massive game changer for us, because that's probably one full-time pharmacist work that's probably not needed now when you can't get pharmacists. So it's that kind of thing.
Okay, thanks, Debbie. I think, as I say, I think we need to make sure that it's all part of that strategy, and we're certainly not suggesting switching stuff off. As I say, it's making the best use of what we've got available to us with the resources, both, you know, capacity wise, technology wise, financial wise, to ensure that we can deliver everything that we need to deliver. I might, Debbie, if it's all right with yourself, I might pick up a conversation with you after this in terms of the little bit that you just spoke about. I think it'd be useful for me to get some more information from you, if that's okay.
Yeah, absolutely.
Thank you. Okay, and so that's digital comms. I've talked about the PCOP and digital pathways framework at the start. Cloud-based telephony will be working through further supporting you with that in 24-25 up to the end of quarter one 24-25 is what NHS England have put as a deadline for everything to be in. I have a feeling that might slip, so we'll be supporting you up until the conclusion of that. And then the service delivery fund scheme, service development fund scheme, should I say, will be looking at what we want to do as well. That's probably much more around sort of the innovate space. So the sort of AI, RPA stuff, and looking to develop that scheme as well. So we'll consult further with you when that's formed. We're just waiting on confirmation of how much funding we might be able to access to do some of this stuff. So there are our key focus areas. Finally, what I wanted to talk to you about was the digital maturity assessment, which is something that we need to do for the first time in a while in primary care. The providers have had to do this for a number of years. And basically, it helps us as a system to understand our level of digital maturity, identifying key strengths and gaps for the provision of digital services. The data that we provide goes to NHS England, and then that data then informs some of the central thinking, central decisions that need to be made. it follows the what good looks like framework, which there are 7 pillars of. So is a system well led? Does it ensure it has smart foundations? The safe practice, does it support people? Does it empower citizens? Does it improve care? And does it have healthy populations? So they're the 7 pillars of the what good looks like framework. So we've got 40 pages of questions that we need to answer. So really looking forward to it being launched and getting stuck in to that. I'm sure you can imagine. It needs to be submitted between the 13th and 20th of May. So Vinay and I will be working through that. It's an ICB primary care wide return, so it doesn't have to be done via GP practice. I'm sure you'll be very pleased to know, but there might be some questions on there where we might just need to get just to check some bits and pieces with you. So if there's anybody who would be willing to act as a peer reviewer for the digital maturity assessment return, I'd be very happy to hear from you, and I would thank you in advance for your support. So that's all I wanted to talk to you about on that, and that's all I wanted to talk to you in general. So thank you very much for the opportunity. Any questions or feedback?
Well, I was going to say, if it's okay, there are some questions in the chat, but I'm conscious of time. If we can send them over to you,
yes, of course,
to look at and then get responses back, that'd be great. If that's okay.
That's no problem at all.
Brilliant, thank you so much for that. So yeah, I'll share all the comments and the questions in the chat with you, and we'll share the responses in our newsletter if that's okay. So yeah, thank you very much, really appreciate it. I'm going to hand straight over to David and Mark from Ardens.
Hello, hiya, can you all hear me?
Yes, brilliant.
Excellent.
Thank you for
Welcome.
your patience and waiting.
Hi, no problem at all. My name is Mark. I've got my colleague David on the line as well. I cover the System 1 side of Ardens, and David covers the EMIS bit. I thought we'd go with the System 1 side first because there seems to be more in your area that are on System 1 that are on EMIS. But welcome everybody. I will be going through basically the LTC system that we've got built into System 1. I will give you a very quick whistle-stop tour of it. As you can appreciate, it's quite a big kind of a project that you would take on within your practice if you were to start using the LTC system that System 1 have created. And just to let you know that every practice that is using Ardens at the moment, whether you're on System 1 or EMIS, will can have a free 2-hour webinar going over this in more detail. As a practice, we could discuss more about how you guys work and how you can actually explore using the Ardens resources for LTC in there. For any practices that aren't using Ardens as well, don't forget you do get a three months free trial of using it. You get free training during that period of time as well, for us to show you how it all works. And of course, at the end of that 3 months free trial, you can decide whether you wish to continue using Ardens or not. So you do have that option too. I can put up some screenshots of those kind of things later on at the end, of how you can contact us and book in training as well. But I'll quickly start off. So I've got a System 1 test patient open on here that you can see on my screen. Basically, the way that it works on both systems, really, and obviously I'll talk more about System 1, is based on the month of birth process. For any patients that are born in the month of April, May or June, or whatever it may be, the month before they can be contacted and sent a letter, an email, a text message, or whatever it may be, to invite them to come in for their long-term condition reviews. And you're getting all of those done in one big hit, rather than targeting patients with, 1 month you do get them in for their asthma, the second month you get them in for diabetes, and so on and so forth. You're actually getting it all done in one big hit, which will cut down the amount of text messages, hopefully, that you send as well. We were just discussing earlier, because you'll be doing it for that one hit per patient. The actual reports are held under Ardens Limited, and there's a little folder called LTC Reviews in here. So any of you guys that deal with kind of reports and sending out invites, we've got it all set up here for first, second, and third invitations. You can do QOF only, which is just based on obviously patients that are on QOF registers. There's also an option to do QOF and best practice, which would be both QOF registers and patients that will be on best practice as well. So you'll be able to do, you can choose between either one of these if you're going to start using the LTC process. On our handout, which I'm going to pop into our chat in a minute as well, and when David's talking, I'll do my bit, you'll be able to see what conditions those are based, and basically the support article that I've got would explain a lot more in more detail than what I've got time for today to explain how to do that. But of course, as you all know, with System 1, you can run a report, you can right click, and you can do your bulk actions. For those of you that use Communication Annex, you could very easily send your communications through there on the system. We also get you to code things as well, so you can do the QOF condition codes, and there's also a process code that we'll get you to do as well, which if they don't respond to that first invite and don't book an appointment, or don't get seen through the system, you'll then be able to send them a second invitation through another bunch of reports, which obviously for patients that would have had that first invite but hasn't seen anybody had any work done on them. So that's the reporting. There's so much more to it which I don't have time to go through, in which you can cover a whole bunch of activity stuff and who's doing what, and who's still waiting, who needs blood tests required, and all that kind of stuff, which if we did book some training in, we'll go into a lot more detail with you. We've also created that works in place with these reports really are the clinical template that we've created on Ardens, and this is found when you're in a patient record. So every patient that you've got, if you're in Ardens using practice, when you go into their records, you'll see this little icon which looks like a little man in front of a house. It's between the doctor's bag and the red telephone. In there, when you hover over it says it's the long-term condition review templates, and if you click on here, what this template does is it brings together all of the long-term conditions and best practice conditions as well, if you're using that too, that the patient is on, and it will lay out all of the work that needs to be done for that patient for everything within their conditions. We've got a booking screen for receptionists. So if you wanted your reception team to be able to go in, see what conditions they got, see if they need any blood tests booked, you can create free slots presets and shortcuts to the ledger screen in there. Patients can decline, which will take them off the second invite list, for example, if they rung through and said they didn't want a first invite. You can send pre-assessment questionnaires, so really good for things like asthma reviews. So we created loads of questionnaires on Ardens that you could send to patients as well, get them to even do their ACT scores on there, so that they could get a really good a lot of their asthma reviews done even before they see a nurse, so they got options to do things like that. Of course, the booking screen would tell the reception team if they have asthma or any respiratory conditions and diabetes and anything else that obviously falls within that QOF and best practice remit. We've got two clinical templates too. We've got an initial review one and a follow-up review. So the initial review one would be used by healthcare assistants and phlebotomists and people like that. So in here again, it tells you what conditions they've got, but it also tells you what blood tests are required for this patient to have, for you to be able to obviously complete that long-term condition review, including bloods that they need for the medication they're on as well. So if they're on any valproates or thyroxines or something such as this patient is, it tells us all of the bloods that were required for this patient to have done for a good thorough kind of a long-term condition review. In here you've got shortcuts to do those blood tests, a little blood test template here which can take you into your electronic pathology if you use that, or label trace if you use that as well, and obviously your blood sample taking codes along with a list of those bloods again available for you to go in and do. There's also, if I just move out of this template, a work to do list too. So this is the work to do for this patient of all the work that needs to be done for this year, and it works in real time. So if I went in and decided to record this patient's smoking status, I've got relevant templates that are lit up down here on the right hand side that are linked to this patient. This patient has these conditions, hence why they're lit up. They don't have not frailty register or epilepsy or anything like that, so therefore those are greyed out. But it will allow me to click on those templates move it to one side, see what work is needed to have done. And if I went in to record their smoking status, for example, I can go in and record that just quickly. You notice that's knocked it off the list straight away. So this works in real time and updates it as you go through. So hopefully this list will shrink as you start to see these patients, and all that work will get done. This work will all be cough related, or national contract stuff will be in here as well. As you can see, there's some NCD stuff at the bottom there that needs to be done on this patient too. So any kind of payment things you need to do on your patients will be shown in this work to do list, which as your nurses and doctors are doing it, they can go through and it will get ticked. There's a little initial button here which will mark that it's been that's been done by the healthcare assistants. That will stop that next letter going out, and then obviously that next appointment could be booked for the practice nurses for them to do their bit. And we've created a tab for them as well, so you've got a little follow-up review tab here, which for those of you that will be familiar with System 1, you'll be able to get into the full kind of templates in here, whereas you won't do on the initial review, because healthcare assistants wouldn't need to see the full diabetic template. But if I was doing a diabetic review on this patient, I'll get a little diabetic button there, and it would take me straight into the diabetes template for me to do a review as a practice nurse on there. Again, I can move it to one side, see what work is still outstanding to do, and go in and do that work. Of course, for those of you that are aware, the red stars and all these templates would be the cough related stuff you need to do. Yellow stuff will be local enhanced services. And in this occasion, because it's a diabetic template, the key care processes are all labelled up in here as well. So it's all on this one template for you to go in and do that thorough diabetic review. And of course, anything that gets done will be removed from that list as you do it. Once it's completed, you've got a little completed box there. Once everything's been completed in the work to do list, that will then, I suppose, supersede them, I suppose, for next year then. So then they'll be then off the list for this year. And then you'll be able to then obviously start off with them again next year on there. So it's a full kind of a process that you'll do, and it will be dealt with by the admin team, which will be doing all the kind of the reports and different things like that, and sending out invites and things. And then the clinicians will use this one template. Everyone uses the same template, so you can see exactly where you are as a practice, and that will then obviously it can all be shared, all in one place there. So that was this little template here called the long-term condition review. For those of you that are using Ardens on system already, you'll have access to that straight away. You can have a play with it today. But when you're in that template, there's a little help and feedback button at the very top under our logo, which you'll find at the top right hand side of all of our templates. This help and feedback button will always take you to a support article, and this is the support article for our long-term condition review on System 1. I'm going to pop it into the chats that we've got here, and please do have a look at that. If you go to our website, ardens.org.uk, if you go on there, you can join a free trial if you wanted to on there. If you haven't been using it before, you can sign up for both System 1 and EMIS. And again, I'll pop that in my chat as well for you to go in and do. Okay, so that's a quick overview of System 1. I know we've got a very limited amount of time. Has anyone got any questions or anything before we move on to the EMIS side? Dog's barking in the background.
Helen, do you want to come in?
Yeah. Just a quick mention for managers and admin people that when nurses I'm just speaking on behalf of nurses, when they're doing a complete long-term condition review, they'll probably need more than the 20-minute, 30-minute that we do for one long-term condition. If they're doing a comprehensive review, that's a discussion between practice managers and nurses to make sure it runs, well.
Yeah, and that's why we offer every practice a free 2-hour webinar to go over this in a lot more detail, because I think those are the kind of questions that you'll come with us and say, well, we work like this, how can we make this work for us? And we'll come up with those kind of solutions for you, and kind of those sessions as well are good to be have both clinicians and the admin team in the room, and you can all discuss it as a group. And we find that a lot of them will get, especially the last hour, gets taken over by you guys kind of discussing how you could make that work as a practice, and we'll just give you the tools that we have and our knowledge of the systems and obviously the Ardens as well to help you with it. So yeah, but it could be quite a big change, for you moving to one thing for another. So, we want everybody involved in it as much as possible. But yeah, you're right. You would have to look at timings and things like that. This is Donna's asked the question: is this included in the standard contract or only pro? It's included in all different all versions of Ardens. You'll get access to long-term condition review stuff. So you'll have that as soon as you switch on. You'll have access to that. So that's not it doesn't matter what version you want at all. It's there for you to use.
Thank you. Debbie, you've got your hand up.
Yeah, I'm just does it include things like all the medications, so not just your quaff and everything, but if you've got like people who are on medications that need a 6-month check or anything like that, does it include all that stuff?
Yeah,
well?
so if you've got patients that are on certain medications, it will include that, but of course not forgetting this is for yearly invites, so this would be covering your kind of mostly your yearly meds in the way. We do have reports that look for patients that are on more high risk medications, so you can send out high risk monitoring reminders and messages for people that would come in more often with their 6-monthly and 3-monthly DMARDs and things like that. So
yeah,
although that might get included within that yearly update, because it probably fall in place with that anyway, we've got solutions in there for you to capture those 3-monthly ones if you needed to. And we can go through that in that session as well.
Yeah, I mean we've got similar to this, but it's a bit bespoke really to what we've had made for us. And it kind of links in with reception as well, because it'll tell receptionists at what stage the patient's at and who to book them with, and when, so they're not booking med reviews before the LTC reviews and things like that. And the other thing is, say if a doctor wanted to check, say if a patient had a low platelet count and they thought, oh, we need to check it for ITP, say every 3 months or 6 months, can you add anything to these templates? So again, the patient comes into a one-stop shop.
So this is just based on your yearly LTC reviews. Yeah. So if you wanted to do anything that was more, you might want to do a 6-month diabetic review or whatever that may be, we would recommend you using the recall system for that. You wouldn't be able to build it into this necessarily, because it if you could do that, it would do it for everybody in the country.
Yeah, I'm just comparing what we've got to.
Yeah, of course. Yeah.
So, thanks.
Yeah. All right. Any other questions?
Can I just ask a quick, potentially daft question?
Yeah.
So you have on that template the initial review and the follow-up review. Would it be clear once the initial review's been done that it's been done and that they're coming in for the follow-up review?
Yeah. So basically, this little box down here, initial LTC assessment, when that gets ticked, that marks that they've had that initial LTC assessment, and we've got a bunch of reports that you could go in and run to find out who's had their initial done but not had their follow-ups done. All right, so because there will be occasion where you'll get people that will DNA their their diabetic review but see the nurse for their healthcare assistant for their bit. So we've got processes in place for all of that. The actual LTC initial review one, if I was doing an asthma review and I went in to close this, it prompts me to click that button as well to say that I've done that initial review. So I do get a system one prompt to tell them, make sure you remember to tick that button, and I can go in and tick it there. It kind of highlights it. So that is something that does get thrown up at the healthcare assistant as well during their consultation.
Brilliant, thank you.
All right. Okay, any other questions? And I can then hand over to David.
There's no other questions in the chat at the minute.
I can't see anything, no.
Perfect, thanks, Mark.
Okay.
Hi, everyone. My name is Dave. As Mark says, I'll work on the EMIS side of the Ardens business. So very similar to what Mark's just gone through. I'll take you through very briefly the searches, the reports we've built for long-term condition invitations, and we'll touch on those template views. in the same way that we've got them for System 1 and EMIS Web as well. Just share my screen a second. So you should all now be able to see the EMIS Web homepage. Perfect. First things first, obviously all of the reports, all of the searches we've written are going to be housed within your population reporting area of EMIS Web. So access population reporting. You'll see your Ardens searches folder, alphabetical order, so it's going to be near to the top. And you can see the first one on the list, which is available to everyone. Doesn't matter which Ardens package you're on, everyone gets access to the long-term condition searches. One or two, I guess, slight changes with the way that System 1 or Ardens System 1 deal with these in that. And again, these are the kind of things that we'll need to have those conversations with you about when you book your training at individual practice level. But from an EMIS Ardens point of view, 3 different systems that you can use. We only recommend using one and not confusing the issue, but essentially System A, when you run these searches, again, based on month of birth. So if I go to run my first invite today for System A, you can see it's combined reviews. Essentially what that means is all patients, regardless if they're on an individual register or multiple registers, will fall into the System A searches. So essentially what you do with this one is invite the patient once on their month of birth. Hopefully they come in, they have the review, you get your QOF points and so on. But first invitation, when you go to run that one, as I say, based on month of birth, so throughout the financial year, today, for example, if I'm ready to invite my May or my June patients in or whatever, just working through the financial year, I just need to change the month of birth. And that's going to identify anyone on a QOF register who is born in the month of April, for example, who's not had their annual review or reviews carried out. So run by month of birth. What it then does is just breaks them down into how you may want to invite those patients. So once you've run the search, you've got the send first invitations, and then that's broken down to a total number right at the very top here. It also produces a report to let you know which QOF registers those patients are currently on, and then breaks it down further to those patients who've consented and been coded for consent of text messages. So if you ran your search for April and it identifies 250 patients, if 225 of them have consented, then you would be able to use this list of patients to export to a CSV, for example, if you're using Accurix, to an Excel if you're using iPlato. So you invite them in whichever way you see fit, maybe send a mail merge and a postal invitation. Following on from there, probably the most important aspect of this is making sure that you then code those patients correctly for their individual QOF invites. Because when it comes to the second invitation, these aren't based on month of birth. These are based, as you can see in brackets here, the time frame that your first invites were sent. So let's say we invite everyone in the month of April. We then code all of those patients on the 5th of April to say that they were invited. What I might do is wait 3, 4, 5, 6 weeks and then invite them for a second time if they have not presented, if they have not been seen. Difference here is when we run, it's not based on month of birth, it's based on the date range or the date that you invited and coded those patients. Do it in lots of different ways. You can see on mine here, I've defaulted mine to search automatically for last month. So again, if I was in the habit of running these every 3, 4, 5 weeks, don't need to change any date ranges on here because it will always look back to the previous month. Alternative would be if it took me maybe a day or two to invite those patients and to manage those patients, then what I might do is say, well, I actually started the process on the 5th of April and it took me until, or up until, let's say the 10th of April to actually code them, invite them, text them, do whatever. So your second invite is always going to be based on when you initially sent that first invite, either by that date range or by previous month or this fiscal year, whichever way you want to do it. It then further breaks down those patients to those that are vulnerable as well. So the vulnerable patients, dementia, housebound, end of life, LDs, are removed from system A as such, and are just in a separate fold, because essentially you'll probably want to invite those patients in a different way, maybe a telephone call, maybe speaking to a carer or a family member as well. So system A, run your first invitations by month of birth, run your second invitations on when you invited and coded those patients, and then you've got your vulnerable patients there. But system A, combined reviews, essentially anyone who's on a QOF register or registers, we would be invited using system A. Alternative is, if you'd prefer to maybe invite those patients in a slightly different way, system B just breaks those patients down into either those that are due multiple reviews or multiple QOF registers, again, which you can target your text for and tell them that they do need a double appointment or whatever the case may be. And then it breaks those patients down into those that are just outstanding a single review. So again, you may want to use these to send out an asthma flurry questionnaire or whatever the case may be. So system A, everyone together, one invite. System B just breaks that down slightly into those that are due multiple reviews or those that are just outstanding a single review. And then finally on here, we've got system C, which is the newest version into here, which just breaks those down into clinic types. So those patients who maybe the precedent is to see them for their diabetic review, but it would also include those patients if they are on any of the cardiovascular registers as well. So if you're doing it by clinical clinic type, diabetes clinic, cardiovascular, excluding DMs, diabetes, respiratory clinics, your asthmas and your COPDs together, and then your mental health patients as well. So as a practice, again, as Mark mentioned, as part of that training, as part of that discussion, that conversation, what best suits your practice? How do you currently use those reviews, those invitations yourselves as a practice? And how can we sort of implement that, hopefully, quite easily within your practice as well. So you get the choice of which one you want to use. There are more detailed review searches within here as well. So again, I'm not going to go into each and every one, but viewing those patients, or maybe those patients who did come in for their initial review with the healthcare assistants, but haven't subsequently came in for their annual review or review. So again, just various searches within here. You've got an overview search, which again, planning for the financial year, allows you to run that one there, broken down by month of birth, and gives you that ballpark figure as to how many patients potentially we're going to need to see throughout the financial year using a month of birth system as well. Okay, so you've got all of those kind of things in there. I'm not going to go into any more of those searches because, again, if we get you booked in with one of those 2-hour training sessions, these are the kind of things we'll go into in a lot more detail. Just touching on what Mark did with the System 1 templates. So obviously when it comes to, you've used the long-term condition searches from Ardens, you invited the patients in by month of birth, your clinicians, your healthcare, your nurses, your GPs, obviously, hopefully using the Ardens templates to capture all of that relevant information, especially to maximize your points and so on. So again, we're just going to flick into our resource publisher area. Obviously, dealing with a patient, you're going to be in a consultation, running the Ardens templates directly from there. But just to give you a little bit of an idea, so if, for example, I've got a patient coming in for one of their respiratory reviews, then obviously you've got the likes of the asthma, the COPD templates to capture all of that QOF information, make sure you're hitting all of your indicators there as well. I'm just going to test this one in here. I'm not going to run through a consultation with it, but again, a change that was made to all of the Ardens QOF templates recently for the new financial year is the fact that they're now more smarter working, maybe not so much smarter as in the kind of things Mark can do with System 1, but essentially what we do here is add all of the green ticks when that patient has met that criteria, and left the red crosses on for those points that are still remaining for this financial year as well. So the national contracts page basically just summarizes all of your QOF indicators and just highlights the fact that, you know, nothing needs to be done for COPD 010 because we've already reviewed this patient, but there is still QOF information outstanding for the likes of smoking 02, 4 and 5. So it just highlights that to you as well. And as Mark showed you, the sort of the master template that you use from a System 1 point of view, equivalent from an EMIS Ardens point of view, and hopefully your clinical staff are using these ones anyway, but are the multi-morbidity templates. So we've got a few, got an initial consultation, which is the one that your healthcare assistant would do on that initial appointment, that run-up appointment, bloods, all of the readings that they may do, smoking status and so on. And then you've got the annual review for when that patient presents. Again, bear in mind what you're trying to do here is streamline the way that you invite patients rather than patients getting several invites throughout the financial year, using the month of birth system. And where it's appropriate, where it's applicable, if time permits, then you can use those multi-morbidity templates to capture as much QOF information within that one appointment. So I'm just going to run the annual review one, just to give you a little bit of an idea. If you've not seen these, again, these are all part of the standard Ardens package for everyone. Just have to wait for a second or two for EMIS to have a think about running that template. But what we have here, similar to the way that you do with System 1, but obviously the EMIS equivalent. When you run the Ardens multi-morbidity templates, either the initial one or the annual review, what that will do, as you run that template on a patient's record, it will check in the background, it will see which QOF registers the patient's on, and it'll create a bespoke template for that particular patient. So on the left hand side, asthma, COPD, CHD and so on, these are all of the registers this particular patient's on. Idea being, if you can afford to do it, if you do have the time, then you would potentially be able to capture all of your asthma information for your QOF indicators, all of your COPD, and so on and so forth. So that left-hand side changes for every patient. It's based on their actual QOF registers, and it creates a bespoke template for you to offer your clinicians to complete as they see fit. Again, if I'm one of the nursing team and I don't deal with cancer and palliative care or dementia, then again, I can just move on to whichever area is relevant for me when it comes to that particular patient's care as well. So you've got the searches, got the templates to capture all of that information. Other things just to finish off with, and again, I'll just post this information on the chat in a second or two. So ardens.org.uk. It's going to take you to exactly where you've seen Mark earlier, signing up for that 3-month free trial if you wanted to do that, if you're not already a customer. Go to the support section, and that gives you access to all of our support articles when it comes to the EMIS, the System 1 or the Ardens Manager side of the business. But just go into support. A couple of things on here. There are a huge number of support articles just in and around the recall system. So again, here you've got all of the introductions to the various system A, B, and C, along with all of the other support articles that you may need. So I'll just pop that on the chat in a second or two. And then if we take a step back from there, I'll look back to our previous EMIS support page. On here, you've also got the national webinar recordings on here as well. So after today, again, we'll give you the email address of the team to contact if you would like to book any training. Alternative to that is if you go to the webinar section for EMIS Ardens, then you've got all of the pre-recorded national webinars that we do throughout the financial year. So again, optimizing your recall processes, prioritizing work for 23, 24. So all of these kind of things, again, I'll post the link onto the chat if you want to just watch these webinars first before you come to us for a sort of a formal training session. Then obviously they're all freely available and you can watch them at your leisure as well. So I'll pop those on the chat, but if there are any questions, please just feel free, anyone. I can see maybe 1 or 2 hands up, I think.
think those may have been legacy hands from before. But are there any questions at all from anyone? Oh, Khalid.
It's not a question, it's just a statement. I've got no personal interest in Ardens, conflicts of interest, but mid-knots, we really like Ardens and we've been using it for quite a while. I'm the mid-knots lead for Ardens document team. So if there's any changes that need to be made Nottinghamshire wide on Ardens system 1, I need a copy, a Word document form of why of the change in clinical templates, and Ardens responds usually quite quickly within a matter of weeks. System 1 and EMIS, you can go into a black hole because they have a completely different system, and they if I say tortoise response is being generous as them, but Nottinghamshire wide, I'm the link. So if you put my email address on the chat, if people need a change in template, but it's not a personal individual practice change, it has to be Nottinghamshire wide, changing referral templates, changing clinical templates, I'll be the one who sorts it out.
Thanks, Khalid. Okay, well, thank you both for coming along. Really appreciate your time and your patience for waiting and showing that presentation. Hopefully it'll be really useful for some people if they've not used it before, just to have a look into it. You know, the 3-month free trial is a really good offer for practice to test before, you know, they commit to anything. So thank you both for coming along, really appreciate it. And I'm sure if we've got any questions after this, we'll definitely get in touch and pass details along. Thank you very much. So thank you everyone for sticking around to the end. Just want to say we have CQC coming next week. We are going to record the session again for those that aren't able to make it. But if you have got any questions that you want to ask in advance that you maybe don't want to ask on the day, please do let us know and we'll happily share those with the inspectors ahead of the meeting next Monday. But thank you all for coming along and have a good week. See you all next week.
Thank you.
Thank you.